In this video, you will learn how to score the GAD-7 assessment and how to enter the assessment results into Practice Fusion. Remember that the GAD-7 assessment should only be performed with patients aged 12 and up. Go through questions 1 to 7 with the patient, circling the respective answers. Once you have all of the answers, you can go ahead and total the score. As you can see, here we have our patient responses. At some point, it's important that you write down the patient record number at the top right corner of your assessment sheet before turning it into the scan bin, as we did right here. So now we're going to total each column by adding the numbers. So in the first column, 0 plus 0 is obviously 0. In the second column, 1 plus 1 is 2. In our third column, 2 plus nothing else is 2. And in our final column, 3 plus 3 is going to be 6. So 0 plus 2 plus 2 plus 6 makes our total score a 10. So our patient scored a 10. It's important to make sure that if your patient selects anything, any number other than 0 for any of these responses, that you follow up with this question. The question is, how difficult have these problems made it for them to do their work, take care of things at home, or get along with other people? And the options are not difficult at all, somewhat difficult, very difficult, or extremely difficult. And as you can see, our patient mentioned that the problems make it somewhat difficult. So now we're going to get the final score or interpret our score. So as you can see here, 0 to 4 means minimal anxiety, 5 to 9 would mean mild anxiety, 10 to 14 moderate anxiety, and 15 to 21 severe anxiety. And since our patient scored a 10, they have moderate anxiety. So now that we have the patient score, we're going to go ahead and enter it into Practice Fusion. So open your encounter notes and scroll down to the SOAP note sections. And here we are. We're going to pass subjective, objective, and you're going to find the place to enter the result under assessments. So even if you aren't required to enter an assessment note because you are first year, you're still required to enter the screening, intervention, or assessment, otherwise known as SIAs. So we're going to press add and search for the procedure, which is GAD-7. And it should pop up. So we're going to pick assessment using generalized anxiety disorder 7 item score, which is the GAD-7. And we're going to change the status from ordered to performed. And in the comment is where you're going to enter the result. So our patient scored a 10. So we're going to type that in. And the interpretation of the result. So a 10 means moderate anxiety. And that's it. You're going to go ahead and hit save. And now it'll pop up in the encounter notes under screening, intervention, and assessment. So if the provider that you are working with that night wants to go ahead and review it, or if a future provider or for data reasons, staff is going ahead and, tallying up that information, we can find it in the encounter note. And that's pretty much it.